The human colon, a vital part of our digestive system, is a marvel of biological engineering, responsible for absorbing water and nutrients while forming waste. Yet, within this essential organ, abnormal growths, known as polyps, can sometimes develop. While most polyps are benign, some have the potential to transform into cancerous tumors over time. This slow progression is both a challenge and an opportunity. A challenge because early symptoms can be vague or absent, and an opportunity because this extended timeline often allows for detection and intervention before the disease becomes advanced. Imagine a tiny seed, planted silently, slowly growing beneath the surface. If we can identify that seed early, before it takes deep root, our chances of removing it completely are significantly higher. This understanding forms the bedrock of why recognizing the signs of colon cancer is so critically important. It's not about fear, it's about empowerment through knowledge. One of the most insidious aspects of colon cancer is its chameleon-like ability to mimic other, less serious conditions. This is where the true challenge lies, and why it's crucial to be discerning. For instance, changes in bowel habits are often dismissed as simple digestive upset, a consequence of diet, stress, or even travel. But what if those seemingly innocuous shifts, a sudden onset of constipation after years of regularity, or persistent diarrhea that defies typical remedies, are whispers of something more significant? It's not about panicking every time your digestion feels off, it's about paying attention to persistent and unexplained alterations. A classic example is a change in stool consistency, becoming narrower than usual, often described as pencil thin. This can indicate an obstruction in the colon, a blockage that prevents stool from passing normally. While a temporary change might be harmless, a consistent narrowing, especially if accompanied by other symptoms, warrants a conversation with a healthcare professional. The key differentiator here is persistence and lack of a clear, benign explanation. Another symptom that often goes unheeded, yet carries significant weight, is rectal bleeding. Now, let's be honest, seeing blood can be alarming, and often, it is due to more common and benign conditions like hemorrhoids or anal fissures. This is the twist in the story, the seemingly obvious sign that can lull us into a false sense of security. However, the crucial distinction lies in the nature of the bleeding and its association with other symptoms. Blood from hemorrhoids is typically bright red, often seen on toilet paper or dripping into the bowl, and usually accompanied by itching or discomfort around the anus. Blood from a colon tumor, on the other hand, might appear darker, mixed with the stool, or even give the stool a tarry or black appearance, melena, if the bleeding originates higher up in the digestive tract. It's the persistent, unexplained presence of blood, particularly if it's mixed with stool or dark, that should raise a red flag. Don't simply attribute every instance of rectal bleeding to hemorrhoids, especially if it's a new occurrence or differs from previous experiences. This seemingly minor detail can be a profound clue. Abdominal discomfort, a broad and often vague complaint, can also be a harbinger of colon cancer. We all experience DZ10 stomach ache, from time to time, whether it's indigestion, gas, or menstrual cramps. But when this discomfort transitions from fleeting to persistent, from mild to cramping, or when it's accompanied by other concerning signs, it demands attention. This discomfort might manifest as persistent cramps, gas pains, or a general feeling of fullness or bloating that doesn't subside. Imagine a persistent, low-grade ache, a feeling of unease that settles in your abdomen and refuses to leave. It's not the sharp, acute pain of appendicitis, but a more chronic, nagging sensation that something isn't quite right. When this abdominal discomfort is coupled with unexplained weight loss, fatigue, or changes in bowel habits, the alarm bells should truly start ringing. It's the combination of symptoms that often paints a clearer picture, transforming individual, seemingly benign complaints into a constellation of warning signs. Unexplained weight loss is perhaps one of the most concerning and often overlooked symptoms of many cancers, including colon cancer. Losing weight without consciously trying through diet or exercise should always prompt investigation. Why does this happen? A growing tumor can consume the body's energy, altering metabolism and leading to a gradual, often insidious, decline in body mass. Furthermore, the tumor might cause a decrease in appetite, nausea, or an inability to properly absorb nutrients from food. Think of it as your body expending energy on an unwelcome guest. If you find yourself shedding pounds without an obvious reason, if your clothes are suddenly looser and you haven't changed your lifestyle, this is a significant payoff moment. A crucial signal that your body is under stress and requires medical attention. It's a stark contrast to the intentional weight loss many people strive for. This is involuntary and often accompanied by a feeling of general malaise. Persistent fatigue, a tiredness that isn't relieved by rest, is another subtle yet significant clue. Many of us experience fatigue due to stress, lack of sleep, or demanding schedules. However, cancer-related fatigue is different. It's a profound, debilitating weariness that permeates every aspect of your life, making even simple tasks feel monumental. This fatigue in colon cancer can often be linked to anemia, a reduction in red blood cells, caused by chronic blood loss from the tumor. When your body is constantly losing blood, even small amounts, it can lead to iron deficiency anemia, depriving your tissues and organs of vital oxygen. The result is a pervasive exhaustion that no amount of sleep seems to alleviate. This isn't just feeling a bit tired, it's a deep, bone-weary exhaustion that impacts your ability to function. If you find yourself constantly drained, even after a full night's sleep, and this fatigue is accompanied by other symptoms like pale skin, shortness of breath, or dizziness, it's imperative to seek medical evaluation. A feeling of incomplete evacuation, or tenesmus, is another specific symptom that can point towards colon cancer, particularly if the tumor is located in the rectum or lower part of the colon. This sensation is the persistent urge to have a bowel movement, even after you've just been to the bathroom, coupled with the feeling that you haven't fully emptied your bowels. It's a frustrating and often uncomfortable sensation, as if something is still present that needs to be expelled, even when nothing is there. This can be caused by the tumor itself creating a mass effect, stimulating the nerves in the rectum, or partially obstructing the passage of stool. If you consistently feel this urge, even immediately after a bowel movement, and it's a new or worsening symptom, it's a significant indicator that should not be ignored. It's a direct signal from your body that something is physically interfering with the normal elimination process. Iron deficiency anemia, as mentioned earlier, can be a direct consequence of chronic, often unseen, blood loss from a colon tumor. While iron deficiency can stem from various causes, including dietary deficiencies or heavy menstrual bleeding in women, when it occurs without an obvious explanation, especially in men or postmenopausal women, colon cancer should be considered as a potential underlying cause. This is a critical twist. The anemia itself is a symptom, a consequence of the cancer, not just an isolated condition. A blood test revealing iron deficiency anemia, particularly if it's severe or persistent despite iron supplementation, should prompt a thorough investigation of the gastrointestinal tract. Your doctor might then recommend a colonoscopy to visualize the colon and identify the source of the bleeding. It's a powerful example of how one seemingly general medical finding can be a specific pointer towards a potentially serious condition like colon cancer. It's crucial to understand that none of these symptoms, in isolation, definitively confirm a diagnosis of colon cancer. Many of them can be attributed to less serious conditions. However, the persistence of these symptoms, their combination, and their worsening over time are the critical factors that should prompt you to seek medical advice. This is where the real value lies, in understanding that your body communicates through these signals, and learning to interpret them. Don't dismiss new or persistent changes as, just something I ate, or, just stress. Trust your instincts. If something feels off, if a symptom lingers longer than it should, or if multiple symptoms start appearing together, it's time to consult your doctor. Early detection significantly improves treatment outcomes and survival rates. The average time for a polyp to develop into cancer can be 5 to 10 years, offering a crucial window for intervention. This slow progression is a gift, providing opportunities for screening and early diagnosis, but only if we are attuned to the signals our bodies send. Remember, colon cancer is highly treatable when detected early. Don't let fear or embarrassment prevent you from discussing your concerns with a healthcare professional. Your proactive approach could be the most important decision you ever make for your health. If any of these signs resonate with your current experience, or if you have any lingering doubts about your bowel health, please do not hesitate. Contact your doctor immediately for a comprehensive evaluation. Your health is your most valuable asset, and a timely conversation can make all the difference. Your future self will thank you for listening to your body's whispers today.